the fast-paced news you need
with all the energy of your morning coffee.
Come see the difference on Morning Rush, weekdays on 11 Alive.
Weather can't run from the all-new 11 Alive Thunder Truck, a mobile weather center with the power and speed to chase down the strongest storms and bring you on-the-ground conditions. The 11 Alive Thunder Truck, sponsored by Landmark Dodge.
Here in Atlanta, bad weather means bad traffic. A few drops of rain could destroy a commute. But that's where my man Crash Clark comes in. I go street level, he goes next level. Together, we make sure you get to work on time. Morning Rush, weekdays 5 to 7 on 11 Alive. Hey, quick, open up your phone camera right now. Aim it at the screen to download 11 Alive's new and improved app. This QR code will take you right to the App Store or Google Play. One simple tap gives you enhanced radar, street level zoom, and severe weather alerts. It's just that easy.
Atlanta roads are my thing. ITP, OTP, Ponce, Piedmont, all the peach trees. Combined with Chesley's street level forecast, that's a lot of tech and experience to help your commute.
Morning Rush, weekdays 5 to 7 on 11 Alive.
We're quite the combo.
Weather changes can make or break your day. That's why the 11 Alive Storm Trackers are always watching what's coming next, delivering accessible and accurate forecasts that prepare you, not scare you. The Storm Trackers, only on 11 Alive.
COVID-19 is still spreading in Georgia. Now get facts, not fear, at 11alive.com/COVID numbers. Track cases by county using our interactive map and get the latest health department data. Visit 11alive.com/COVID numbers.
Health experts fear we're just at the start of another surge.
Residents here are some of the first seniors to get the vaccine.
This epidemic can come to an end.
We do have a flash flood warning that just popped up here.
The fallout of this is just beginning.
The bigger questions are the longer legal ramifications.
Morning news should be both informative and fun.
Gone are the days where we're speaking at you. On Morning Rush, we're speaking with you.
So connect with us. Talk to us.
Think of it as a conversation.
Morning Rush, weekdays 5 to 7 on 11 Alive.
Quick, open your phone camera right now, aim it at the screen to download 11 Alive's new and improved app. This QR code will take you to the App Store or Google Play. One simple tap gives you enhanced radar, street level zoom, and severe weather alerts. It's just that easy.
Morning news should be informative and fun.
Yeah, and we do that here on Morning Rush with Verify, Connect the Dots, Why Guy, and more.
We love learning about new things and sharing them with you.
We make the news make sense.
Morning Rush, weekdays 5 to 7 on 11 Alive.
The Negro people had to leave. They were told to get out.
White only, no black!
1912, all but one issue has been erased.
We haven't had none up here since the 1st of the century.
What's the importance of making sure this history isn't erased?
So that it doesn't happen again.
Is your morning routine feeling a little routine?
Then mix it up.
Morning Rush is different.
It's the fast-paced news you need
with all the energy of your morning coffee.
Come see the difference on Morning Rush, weekdays on 11 Alive.
Weather can't run from the all-new 11 Alive Thunder Truck, a mobile weather center with the power and speed to chase down the strongest storms and bring you on-the-ground conditions. The 11 Alive Thunder Truck, sponsored by Landmark Dodge.
Here in Atlanta, bad weather means bad traffic. A few drops of rain could destroy a commute. But that's where my man Crash.
Waffle House wants to make it sugar and pepper. Woo! What's wrong with that? Very good. What is wrong with that? What's wrong with that? Well, don't worry.
We do make our appointments online. Patients will check in at the reception area there. That's where a technician will take their information, their screening sheet, and verify insurance. So once they're checked in, they alert the pharmacist for when the vaccination is ready. And then we'll call them back into the room.
So is that the same process you guys have for your flu vaccine too, or is it different?
Yes, it's very similar to how we would take in for flu shots as well, yeah. So that's,
what kind of vaccine are y'all giving?
we have Moderna here.
And how do you deal with the 15-minute observation time?
Absolutely. So we schedule all of our appointments with a 15-minute interval so that we can make sure that we maintain physical distance and separation so that we can monitor patients effectively. We have all of our tiers 6 feet apart as well and have accommodations to do so in other stores.
So what have y'all thought about, like, if you ever got more supply and you had to tighten up the time frame, like if you were doing it every 5 minutes?
Absolutely. We do already have a game plan.
I guess you could let people just wait in the parking lots.
Well, we have a game plan for that, even to have them sit here, because we want to be able, in case that there is an anaphylactic reaction, with it being a new vaccine, we do want to make sure that everyone is safe. So we have store plans already in place to where we can space out chairs. We also have other areas in the pharmacy and also like in our cafe areas maybe that aren't being used, that we might be able to use those. That's a great idea. So there are some areas that are bigger that we can maybe even bring in more pharmacists and be able to take care of patients that way.
That's great to hear, because I mean, we're working on mass vaccination sites, but we also want to use the power of the private sector, kind of how they're spread out. I mean, you got all these different great businesses like Kroger that are in different places and different parts of town. And so, I fully envision that continuing when we get more supply.
Absolutely.
Yeah, absolutely. Looking forward to that day because we know it's coming. We're planning already and we're ready.
I'm thinking about the older individuals who maybe can drive here to shop, but not down their Mercedes-Benz. And this is so convenient for them.
Well, the good thing, too, like the Kroger where we are, I'm sure it's probably the same here, but, it's on the bus line, on the public transportation. So you got people that don't have transportation that can still get to the Kroger.
We have 165 locations in the state, and as you well know, in Metro Atlanta, they're fairly spread, so it's a good mix.
It's great for our rural locations too, because a lot of rural counties in Georgia don't have healthcare providers, don't have access. So the pharmacy is a really great point of contact, sometimes the only healthcare professional they'll see.
Well, people trust their pharmacy, which is good. It's a lot different, with public health. I mean, there's a lot of people that go to public health all the time. There's a lot of people that don't. I mean, they don't know where their public health office is in the county, but they know where the pharmacy is.
Absolutely.
Utilize everything.
We're going to step back and take a look at the outline here.
Sure. Yeah. So this is where we would take a patient back. We usually have them have a seat in that chair right there. This is just some examples of the documents that the screening sheet that they would fill out so that we can make sure that they are eligible for the vaccine. So there's a few things we just want to make sure to go over with them before that they do receive the vaccine. So once we screen,
how long does it take now?
It typically does not take too long.
Do they fill that out before they come in or while they're in here? Like talking to them when that's going on?
They actually can fill this out even online so that it's already done and it comes through our computer. It does speed up the process that way, so that way we do have the opportunity to screen them and make sure there's no potential problems before they receive the vaccine. So we talked to the patient, interviewed them a little bit about this vaccine, and then we also let them know that they're going to be receiving the Moderna vaccination. So what that means and what that means for them, because it is important to just calm their fears. Everybody is a little hyped up about everything that's new. Dose.
And they get
correct. We will schedule their second dose. Yes, once they have received their vaccination. That is correct. Yes.
What do you do if they don't bring their card back with them, like the second dose?
We can issue a new card. That's not a problem. We also do have the grit system so that we can verify, that they are receiving the same dose and that it is within the acceptable time range.
Great.
So we do let them know it's due in 28 days. So this is an example of the infamous card you've probably seen all over the internet. And we just fill this out, and then on the back it has the date that they're recommended for that 28-day interval. And so we do encourage them to hold on to that, take a picture of it, because that is proof that they've received their vaccinations. The second sheet we give them is the emergency use authorization form. So this just lets the public know that this was approved under FDA for investigational use for the public. So that's important for them to have, so they have information on the vaccine. The last page we give them is the V-Safe program. Yeah, so we do encourage patients, if they have any side effects, it checks in with you about every. It just checks on your symptoms of how you're feeling. And it gives that information to the CDC so they can get feedback on the vaccine and how they can better improve the vaccine as well. So it's a voluntary program, but we do encourage everyone to fill that out. And then I usually talk about the side effects, about the arm, fatigue, chills, fever, and then it's all pretty common but resolves within a few days. So I think it's important that we take the time to explain to our patients it calms their fears about it being a new vaccine, but it's also very helpful.
Back afterwards to tell you how they did, or have you had?
Absolutely. I mean, I have a card in here actually that we're just saying, in times of adversity, we know who to count on, and Kroger was there for us.
Oh. Nice.
Yeah, so it's been great. I mean, my staff has gotten lunches, treats, all kinds of things. So it's really great to be able to have that place in the community, and patients are so grateful for it.
Well, I think the thing too, walking everybody through it, they're going to be the marketers for the person that may not be a little uneasy out there.
Absolutely.
Which is important, because I mean, we talk about that literally just about every day. But there's still, we just know there's a lot of people, even healthcare workers, that aren't taking it. So I think the more comfortable people get and talk about it is helpful.
Yeah. That's definitely our goal, because you're right. People are your best marketing. So when they get out there and they say how great the experience was, then we're able to get more people vaccinated.
Wonderful. And the fact that they're coming for their Shingrix and their DPT and everything else is just...
they're used to us being their shot providers.
Exactly,
their flu shots, they're always here every year, so they're more than ecstatic that they can come across from their neighborhood and come here and do the same thing. So
that's great.
Have you seen the vaccine the way it comes?
Not really.
Look like? Do you have one?
I do, yes. I can absolutely grab one.
Have you had enough syringes? Have you run out of syringes?
We've not run out, but the 1cc ones are a little bit harder to get. I'll say.
So y'all are keeping that where overnight? When you get it, what's kind of your process that you're doing?
When it comes, we do keep it in the freezer. That's how it is shipped to us.
Right.
It can go into the refrigerator for 30 days. So we usually will set out a few vials for what we know that we're upcoming to be vaccinated.
So like if y'all have 30 or 40 vaccines today, you'll take out 2 or 3 vials or however many you get.
Correct.
You can just put that in the refrigerator. And you really got 5 days to use that?
To use once you're open the vial?
Well, just if it's in the refrigerator.
In the refrigerator, if it's not been capped, or it's not been undone, it can last in the refrigerator 30 days.
And then if you open it,
6 hours.
6 hours.
So that,
once you open it, you got to get those shots.
Exactly, correct. And so that's another challenge that we have is 6 hours, and we don't want to waste any doses, so we got to get 10 people and make sure we have 10 people show up to get that vaccine. So, absolutely.
Have y'all had much trouble with people not showing up for appointments?
No, not right now.
I would think so, but every now and then there's been a few.
Yeah.
You have a waiting list too, right? Stores.
Correct.
So you can call somebody and tell them, hey, come on over.
Absolutely.
Get in here within a couple hours.
Yes, absolutely.
Now, I've heard of people in my neighborhood hanging out at the end of the day, hoping there's going to be some extra vaccine.
Yeah.
You're talking about all this, people breaking the protocols. I read an article this morning. There was an actor and her husband, and they took a private plane and flew to an Indian reservation.
Oh, wow.
Canada.
It was a Canada.
It was a Canada.
Yeah, and they pretended like they were hotel employees up there, and got. Of course, now they're facing charges for doing that.
Wow.
Because they're United States citizens, but
No, it's really
I was like,
sad.
my gosh.
Yeah,
Wow.
And Michelle, I don't want to forget the importance of our technician staff and
Absolutely.
the support staff of what they do in this process as well.
Absolutely.
'cause
We
they're
absolutely could not do it without
very
our pharmacy team. So we rely on them heavily to help with the process, the workflow, and everything like that. So our technicians and our staff pharmacists really play a key part in helping the process.
Yeah, I think we signed an executive order, I believe, to allow for more pharmacy techs normally now.
Yes, sir.
And then over the years, I know when I was Secretary of State, we did we worked with the board a lot on pharmacy techs because they're so important, especially in the bigger pharmacies.
Any questions or anything that like the city billing process or anything else over here?
That's great. Good to see.
I'll come back to my TV.
I'll put you down.
What's she putting you down for?
My tetanus shot. It's been 10 years, so I need to get myself in.
Does that hurt more than the vaccine shot?
No. It didn't. Well, of course, it's like I can't remember, so my memory may not be what I should.
Well, I talked to Sheila McNeil, who's a new state senator, and she qualified for the vaccine, and she's gotten her second dose. She had no. That's great. Well, thank you all for your time.
Thank you.
Absolutely, we're happy to
I really appreciate all you're doing.
No, absolutely.
Hey, thank you all. Appreciate it.
And the convenience of the neighborhood. And as you say, that you're a known person.
Helping the community, absolutely. So.
Hey, thanks so much.
Absolutely, thank you.
And check out your dog too.
No, I got no.
Oh, when it comes time to fur kids, it's a different story. This one is a fur kid.
Yeah, my wife is too.
Africa. I brought them back when I was with CDC in Africa.
Oh, wow.
So they're the ultimate family.
Oh, okay. These two could not be more fur kids.
And that's what they eat, the Bill Jack?
Oh, they love these frozen treats.
Oh, yeah.
Frozen treats. They're made with yogurt.
Oh, okay. The ones that used to come in the cup, or they come in?
They come in a bag and they're frozen.
Yeah.
They're the frozen food.
Okay. Well, I found the Bill Jack food.
Yeah, they don't even. Fine. Anywhere.
Oh, I thought it was the Bill Jack food.
And if you can't get them from like online, they come frozen. And they just love them. Not so, but they even patties. All of them.
Sorry. It's far away.
No.
That's right.
So I want to thank the group.
Study today just on the process. I might have to know you now.
Hold on, let me check my VIP contact.
Oh my God.
just because the process is so, I think.
We've done that enough.
Double there. Well, that's a great story. I'll get a chance to talk to you again. Thank you so much.
Yeah, absolutely. Thanks for having us, sir.
No, thank you, sir.
Thank you.
You're welcome.
Want to do that?
Thank you.
I've already told her.
This is great.
I guess he's gonna say right. You coming out?
Well, first of all, I just want to thank the bunch of those involved in the pharmacy operations here and with other stores around the state. They've done about 24,000 vaccines statewide, and like we talked about in our last press conference, and many other fine folks that we have out there that are in this same type of operation, Kroger, Publix, Ingles, Walmarts, and others who are helping us get the vaccine administered all across the state. They can do more if they had more supply. We actually talked about that a little bit. They already have plans to ramp that up to be able to do more when that time comes, which is much like we talked about yesterday with what the state's preparing for, and even the site up in Cobb and Douglas told us yesterday that they could do in reference to opening additional lanes. And it's great to see that our partners like Kroger and others have the ability to do that. Monumental day yesterday as we crossed the 1 million doses of vaccine given. We're now over 500,000 doses for our over 65 age population, our seniors. And those are certainly important milestones, especially for those that are most vulnerable, either from a health outcome or possibly fatality from COVID, and those that are on the front lines of fighting the pandemic. I just want to give you a brief update. I had a Georgia Hospital Association call earlier this week. We did a call with the Metro Atlanta Hospital CEOs yesterday, and what I had been saying the last couple of days, more of the same from them. Their numbers continue to get better. Just about every Metro hospital is down 20% or more with COVID patients. Those that they think may have COVID that they're testing, that number is decreasing as well, which sends signals for a good trend and for that trend to continue. They all are having very much success with their vaccine administration programs in the hospital with staff and their patients. But they also said, especially some of the bigger systems like Grady and others, they literally have hundreds of thousands of patients that that are eligible for the vaccine right now that they can't get the vaccine to because of the supply, which reiterates our message that we want to expand, we want to put more folks in to that category, but we just don't have the supply to do that, and the hospital CEOs confirmed that yesterday. In closing, I would just say that despite the good news that we're seeing, despite the ongoing efforts of getting people vaccinated in the state, with us doing and these great places like Kroger and the public health sites and others across the state, we're getting them in, we're getting them out, and we're getting shots in the arms. But it's going to be hard for us to do much more than we're doing now until we get more supply. And I did just want to mention one thing from yesterday. Someone asked me when I thought I would get we would get the Johnson & Johnson vaccine or more supply. I just want to make it clear, we know what our supply is going to be for the next 3 weeks. We know it's going to be leveled out at this 154,000 dose level,
in conversations yesterday, looking historically at the FDA emergency approval process, I do believe if the paperwork is turned in on Johnson & Johnson, previously on the other vaccines, it's taken 3 to 4, potentially even 5 weeks to get that final approval where they could start shipping vaccines. So I don't see that happening before the end of the month or into the first part or middle of next month, just to make sure people are clear and we're continuing to be transparent. We'll continue to do all we can with what we're getting, and with that, Dr. Toomey and I are both available for any questions you may have.
Governor, have you, during the Trump administration, you would have weekly phone calls with the coronavirus task force. Are you having these similar phone calls with the Biden administration? How are those phone calls going, and have you given any indication as to when the surprise may be?
Yeah, I was actually on one earlier this week. That's the first one I've been on. I think I mentioned previously that a lot of our staff, I know Dr. Toomey is talking to the administration, our health policy people, folks that have been involved in this for a long time, Ryan Loke, Director Stallings, the whole FEMA-GEMA connection I know has been ongoing as we work on our mass vaccination site planning efforts. And then I was on the call, which that's where we learned the small amount of doses that would be going directly to the pharmacies and a few of the other things that were going on this week. So, so far so good on that. We're still, kind of waiting for direction on them or what their plans are going to be that we may not know yet. But in the meantime, we are moving ahead full bore to prepare for the day when we get more supply, so that when that comes, initially we can get that to our existing sites that have the ability to scale up. We can set up state sites. We can do both. Whatever it is that we need to do, we're going to use the full power of state government to do that, whether that includes National Guard, private sector vendors, partnering like we're doing here with Kroger and other folks. We'll do it. That is our number one mission right now, and will continue to be until we get to herd immunity.
CVS and Walgreens just announced that they're starting to give out the COVID-19 vaccine, not here in Georgia. I just want to know, is that because it's their call? Is this a federal call, or is this a state call?
Well, the CVS-Walgreens partnership that was originally part of Operation Warp Speed to go straight to our long-term care facilities, skilled nursing facilities, they're basically wrapping that up. That is, we were losing, well, I hate to say losing, they were procuring 40,000 doses of our original 124,000 that we were getting to go to those facilities. Because they now have the doses they need to complete their work in all these facilities, that's going to free up that 40,000 for us to put it into the general population of first responders, medical professionals, and those over 65. So while it's not new doses for the state, it will be going to a new type population that will help us continue to move the needle. We're working with them now on any excess supply that they have and what's the best way to deal with that. Obviously if people have excess supply, and we dealt with this early on when we had, more supply than demand in rural parts of the state. And we looked at trying to move the vaccine, but logistically that was just not a smart thing to do, which is why we opened up the population when we did, to make sure we're getting shots in the arms. And so we're in a similar situation with CVS and Walgreens right now, talking through how that would look, and we'll keep you posted on that.
Question for Dr. Toomey. I wanted to follow up what you discussed about the appointment system that could roll out later this month. Just looking for more details on that. Is going to be dropped statewide, district by district, and then how is that going to be done, basically?
I don't know if you remember the appointment systems we had for making appointments for the testing. It's very, very similar. In fact, it's the same identical software, just now customized for vaccine, and also will report the vaccine once it's given to the vaccine registry. So it's a Microsoft-based product. We anticipate that all the districts will use it, and we're also planning to have a single, in addition to that, a central call line as well, to try to ease some of the burden on the individual districts and counties because they can't always manage all the calls. So it's going to be a two-pronged effort to both have a district level, county level scheduling system, this Microsoft Dynamics, which is used before. It's going to look very familiar to you, as well as a central call line.
And time frame?
We anticipate, according to Microsoft, that it'll be rolled out beginning the 15th of February, so just in a short time.
Dr. Toomey, I have a question for you as well. Yesterday you talked a little bit about an outreach program to reach communities that are not getting this vaccine. Can you expand a little bit more on that, on what it's going to look like and what those efforts are going to be?
Sure. Actually, we met yesterday with our health directors, and obviously it's going to look different in every district, in every county, because of the needs, and we're making assessments of where those hard to reach populations are who may not be reached by our current vaccine efforts. Several of the districts, many of them actually, have mobile vans that they're planning to use for outreach vans to communities. They're also planning to send staff in along with, say, home care nurses. So partnering with home health care partners to be able to reach those who are homebound. And so it's going to be a multi-pronged effort, but we are coordinating that process, and we'll have be sharing a kind of an outline of what that looks like. But in talking to the health directors, they've already begun that. They're actually further ahead than I realized, and they're already beginning a very aggressive effort, particularly with the mobile vans, to do those mobile clinics as well into hard to reach communities.
Dr. Toomey, what's the timeline on that? You said they're already in the process of launching.
I mean, they were already doing it. I mean, in many of the districts. In fact, in Augusta, they were awarded a grant from the Augusta National, $200,000 for a strike team, specifically to reach high-risk individuals in Richmond County. So this is happening statewide. Fulton has been way ahead of the pack in what they're doing as well. So I think we can make an effort for your benefit to try to put this together in a comprehensive way, so you see how much is being done and how diverse it is, because every community is different, all the needs are different, and the assessment of what those needs are will be different. And we're working also on a special communication campaign as well, because just our overall communication efforts may not reach these communities or persuade them that this is something that they want to do, that the vaccine is something that they trust. And I think it's important that we make those extra efforts to ensure that everyone not only trusts the vaccine and understands the danger of this virus, but also wants to work with us and the vaccinators, and working with communities and churches. These are the sorts of things that are already going on, meeting with pastors to help bridge to these communities.
Dr. Toomey, can you talk about some seniors are still having trouble getting second doses, finding second doses, getting appointments for second doses? What's being done to help these folks, and what advice do you have for them who are still struggling?
No, I'm very aware of this because I've been actively helping many people as well. But I think it's very important to recognize that this is a need. Fulton, for example, is working with their senior services in the county to identify these individuals, and actually has vans that the senior services have that will pick individuals up at senior centers or even in their locations where they live and take them to the vaccine site. It's this kind of partnership that we are trying to encourage statewide, working with the AAA, the aging agencies, as well as the Department of Aging, who have staff who will be working with our health directors, or are already working with our health directors to do things like these partnerships to reach out. But that outreach effort on Fulton's part to actually send a van to the locations where senior living facilities where they live and take them to the vaccine site is the kind of thing we expect to see, and or else our mobile vans going into communities as well. But this is, as I said yesterday, this is something that I spend a lot of time thinking about. It's been on my mind, and we are really very committed to ensuring that we reach all seniors. And the last thing I want to say is, if you look at who COVID affects the most, it's our older Georgians. Everybody's at risk, but it's the older Georgians who are more likely to die or have serious complications. And so we really are very hopeful that we will reach all seniors who are eligible, who want to be vaccinated. And this group, I put myself in it, remember polio and are very anxious to be vaccinated.
I would just add to that too, our whole team is working on that issue. That was something we talked about with the hospital CEOs yesterday in regards to second doses. We were told weeks ago to get shots in arms and to use everything we have, which we did, which kind of puts us in this boat, which is fine. But people just need to know that we're in contact with these folks daily on who needs what, where the supply needs to go to make sure we're fulfilling the second dose requirement in a timely fashion. So I think this has been one of the things, looking back, maybe could have been done a little bit different, but that's water under the bridge. That's just what we were dealing with the vaccine coming from the feds, and we just got to keep filling those gaps, plugging along, and then we get more supply, especially on what Dr. Toomey was just mentioning on underserved neighborhoods, individuals that may be hard to get to, that are limited on their travel options to get to vaccine sites, how we get to those neighborhoods. And really the big question is how we scale that. And that's, we're working on that now. So when that day comes, whether it's a month from now or 6 weeks from now, we'll have teams ready to go or have partnerships ready to go on that.
Governor Kemp, just one more question. Yesterday you touched a little bit about the teachers. They're anxious, especially in Cobb County where they had 3 deaths. Seeing that debate, what can you say about the next steps for them? How long do you think it will take to start getting that vaccine?
Well, look, it all depends on supply from the federal government. I wish we had it today. We have the ability to scale up today. The site we went to yesterday in Cobb has the ability to give vaccines to a lot more people than they're doing now. We just don't have the vaccines from the Fed to do that. I watched the clip of the CDC director last night talking about how safe it is for schools to reopen. That's been going on in Georgia since August and September. This state government, in conjunction with Dr. Toomey and our whole team, we've given 8.3 million units of PPE to our schools. We have bought and delivered the electrostatic cleaning sprayers, chemicals, and other things, given that to the schools to allow them to safely reopen, and other resources. And many schools are doing that. Many teachers have been in the classroom. The data is very clear on that, but that has been left up to the local districts. And I think it's important for people to realize, even if we had the vaccine right now for teachers to be in that class, we're not going to be able to vaccinate all the teachers in a week. You've seen how large the population is for first responders or medical professionals are over 65. It takes, this isn't like a flu vaccine where you pull it out of the refrigerator and pop it and they're out of here. You got the observance period. It's a lot more logistically challenging than a flu vaccine, so it's going to take a while. And if people are waiting to go back to school to get the vaccine, even if we had everybody eligible right now, it's still going to take 2 or 3 months. So you're going to be, almost into the summer break. I personally think kids ought to be back in school. I think it's a safe way to do that. You can protect the more vulnerable teachers, if they are of age or if they are medically fragile, and have them doing other things to help protect them. But the classrooms are set up in many places, and we know that a lot of the individuals that have gotten infected, it hasn't happened at school. It's happened at other gatherings outside of the school environment. So that's why it's important for everyone to continue to follow the guidance, to be smart, But that's a decision that right now lies with the local level, unless the Biden administration can get us more more doses of the vaccine, or changes the directive on who we ought to be vaccinating. I mean, we're vaccinating who CDC and others say is who we need to be doing right now. All right, thank you, everybody.
Thank you.
Thank you, Aaron.
Thank you.